channel. So I will be starting with the CNS pharmacology. So in CNS pharmacology, we deal with the drugs which are used to treat the disorders related to central nervous system. So first we will be starting with sedatives and hypnotics. So first of all, we will learn what are sedatives and what are hypnotics. So sedatives are the drugs which sedate a person. What do you mean by sedate a person? Sedate a person means to produce calmness in a person or to reduce anxiety levels of a person. Since they reduce anxiety levels of a person, they are also known as anxiolytics. So the class of drugs sedatives, they are also known as anxiolytics. Now what are hypnotics? Hypnotics are the drugs which induce sleep. Since they induce sleep, hence they are used for the treatment of insomnia. So there must be some connection between these two classes of drugs. That should be the reason why we study. There must be a reason, there must be a reason why we study these two drugs together. Yes, there is a reason. The sedatives, the drugs which are used as sedatives, if we will increase the dose of those drugs, they will start acting as hypnotics. Now see, if we will reduce the dose of hypnotics, they will start acting as sedatives. Hence there is a reversible relationship between the two classes of drugs. Now for hypnotics, if we will further increase the dose, they will act as general anesthetic drugs. What are general anesthetic drugs? The drugs which reduce the consciousness level of a person. If we further increase the dose, they will cause respiratory depression. If we will further increase the dose, it will lead to coma, and ultimately it may cause death of a person. So now you got familiar with the two terms, sedatives and hypnotics. What is their basic? What is their what what do they mean basically, and what's the relationship between them, and why do we study them together? Now, what are the class of drugs which are used as sedatives and hypnotics? The first one is barbiturates. The barbiturates act by acting on GABA A chloride channel. The next class of drug is benzodiazepines. They also act on GABA A chloride channel. The third one is atypical benzodiazepines or Z drugs. These drugs are known as atypical benzodiazepines because they differ slightly from benzodiazepines in their mechanism of action. They are known as Z drugs because the three drugs discovered in this category, the name of those drugs starts with the letter Z. Now melatonins, you must have studied it in your physiology in first year, that melatonins are released from they are kind of hormones which are released from pineal gland. So these melatonins, they produce sleep in an individual. They act in darkness, and they induce sleep in an individual by acting on melatonin receptors, which are MT1 receptor and MT2 receptors. So let's write it down. The first three class of drugs, they act on GABA A chloride channel. The third, that is the fourth one, the melatonin, they act on melatonin receptor. MT1 and MT2. Now coming to alcohols, I will make a separate video over alcohols. So we will discuss about this drug individually and in a separate video. Now before coming to the individual class of drugs, we will first get ourselves acquainted with the drugs which act on GABA A chloride channel? It is a very important question which have been asked several times in your exams. So see, the GABA A chloride channel is an ionotropic receptor. What do you mean by ionotropic receptor? These act by the influx of ions. So what is the ion? So that is the chloride ion. So GABA A chloride channel functions by opening of chloride channel or the influx of chloride ions. So what is the structure of GABA A chloride channel? It is a pentameric rosette. So it has got 5 subunits. The 5 subunits are 2 alpha, 2 beta and 1 gamma. Now there are various drugs which act on these GABA A chloride channel, but they differ in their site of binding to the channel. So we will study about them now. So first one is the alpha gamma subunit. So the most important agonist, the agonist at alpha gamma subunit is the benzodiazepine. The competitive antagonist at the GABA A chloride channel at alpha gamma subunit is the flumazenil. Since it is a competitive antagonist, hence it is used to treat benzodiazepine poisoning. Now what is the inverse agonist at the alpha gamma subunit? That is beta carboline. Now coming to alpha beta subunit, the alpha beta subunit, its endogenous agonist is GABA, its exogenous agonist is muscimol, and its competitive antagonist is bicusylene. Now there is a toxin, its name is picrotoxin. It blocks chloride influx. Now there are certain drugs which open chloride channel. They are alcohols, propofol and general anesthesia. This is a very important slide for your PG as well as your MBBS MCQs. Now let's talk about the difference between barbiturates and benzodiazepines. So first of all, there's the difference in the mechanism of action. The benzodiazepines, they act to alpha gamma subunit of GABA A chloride channel, as I have mentioned in the earlier slide. They increase the binding of GABA, thereby increasing the frequency of opening of channel. Hence, they are GABA facilitatory. What do you mean by this statement? See, benzodiazepines, they don't increase the opening of the GABA A chloride channel. They don't bind to the GABA channel directly or increase the opening of the channel. They increase the binding of endogenous GABA to the GABA A chloride channel. Hence, they increase the frequency of opening of the channel. That's the reason why they are known as GABA facilitatory. They don't themselves bind to the Now before reading in detail about the individual drugs, we will first study about the differences in between barbiturates and benzodiazepines. Benzodiazepines are relatively safer drugs. So the first difference in their mechanism of action is the benzodiazepines, they attach to alpha gamma subunit of GABA A chloride channel. I have already mentioned this in the earlier slide. Now they bind to the alpha gamma subunit of the GABA A chloride channel and they increase the frequency of opening of channel. This is the reason why they are known as GABA facilitatory. Now what is the mechanism of action of barbiturates? Barbiturates attach to multiple allosteric sites on GABA A chloride channel. In low doses, they are GABA facilitatory, similar to benzodiazepines, that is, they increase the frequency of opening of GABA A chloride channel. In high doses, they are GABA mimetic. What do you mean by GABA mimetic? They directly open the chloride channel. If we will further increase the dose, their action becomes non-specific. What are those non-specific actions? So first of all, we will discuss about the differences between barbiturates and benzodiazepines. The first difference lies in their mechanism of action. How do benzodiazepines work? The benzodiazepines attach to the alpha gamma subunit of GABA A chloride channel, as I have mentioned earlier, and they increase binding of endogenous GABA to the channel. Therefore, they increase the frequency of opening of channel. Hence, they are known as GABA facilitatory. Now, coming to barbiturates, they attach to multiple allosteric sites. Depending on their doses, barbiturates have got different mechanism of action. When we use barbiturates in low doses, they act as GABA facilitators similar to benzodiazepines. If you will increase the dose, they act as GABA mimetic. That means they directly open the GABA A chloride channel. If you will further increase the dose, their action becomes non-specific. So what are those non-specific actions? They will block sodium and calcium channel, and they will block glutamate receptors, that is AMPA and NMDA, and they will also open potassium channel. Now coming to the difference in between their pharmacokinetic properties. Barbiturates are not safe drugs. They have narrow therapeutic index. What do you mean by this narrow therapeutic index? The safety of barbiturates lies in between a very narrow range of their concentration. They become toxic. They are low safety margin drugs. Hence, they require therapeutic drug monitoring. You will study about these. If you're not able to get this point, go to General Pharma, study it properly, and then you will get this point clearly. Now, benzodiazepines are wide therapeutic index drug. They are safer drugs and they do not require therapeutic drug monitoring. Now, coming to the difference in their drug interaction. Barbiturates are enzyme inducer. No such property is seen in case of benzodiazepines. Abuse liability. Barbiturates are highly addictive, so they can be abused. Benzodiazepines are relatively less addictive. Now coming to antidote for poisoning. For barbiturates, no such antidote is available, whereas for benzodiazepines, flumazenil is the antidote. This question is very important. Now coming to hyperalgesia. What is hyperalgesia? Hyperalgesia means increased sensitivity to pain. It is seen in case of barbiturates and it is not seen in case of benzodiazepines. Now coming to effect on CVS and respiration. Barbiturates will cause respiratory and cardiac depression. No such effect on these systems is seen at hypnotic doses with benzodiazepines. Now coming to effect on sleep. Barbiturates are not used for the treatment of insomnia because they suppress the REM sleep. REM sleep is rapid eye movement sleep, and they also disrupt the sleep cycle. Hence, they are no longer used for the treatment of insomnia, whereas benzodiazepines, they have no effect on REM sleep and they cause less distortion of sleep cycle. Hence, they are used for the treatment of insomnia. Now we will study about the individual drugs in great details. So first we will start with barbiturates. So barbiturates are the drugs which act on GABA A chloride channel. They have very non-specific actions, as I have already mentioned in the earlier slide. These drugs end with the name tone, T-O-N-E tone, or T-A-L tull. They are the derivatives of barbituric acid. Now barbituric acid is what? That is urea and malonic acid. So there are three classes of barbiturates: ultra short acting and long acting. So in ultra short acting barbiturates we have two drugs. They are thiopentone and methohexytone. The short acting barbiturates are pentobarbital, amobarbital, butabarbital and secobarbital. We have four drugs in short acting barbiturates. In long acting barbiturates we have two drugs, phenobarbital and mephobarbital. Are yaar In long-acting barbiturates, we have two drugs, phenobarbital and mifebarbital. Now coming to ultra-short-acting barbiturates, the first one is thiopentone. So thiopentone is a cerebroprotective and cardioprotective drug. It is an intravenous inducing general anesthetic drug. It also has some anti-seizure property, and it is a sedative drug, and it reduces cognition. So it is used as truth serum in narcoanalysis. The next drug is methohexitone. Methohexitone reduces seizure threshold, hence it can easily provoke seizures. So it is used in electroconvulsive therapy. Next one is short-acting barbiturates. In short-acting barbiturates, we have four drugs: butabarbital, secobarbital, amobarbital, and pentobarbital. All these four drugs are used intravenously for sedating ICU patients or sedating patients before surgeries. This long-acting barbiturates, we have two drugs, phenobarbital and mifebarbital. Phenobarbital is a very important drug. It is the longest acting barbiturates. It has maximum anti-seizure activity. It is an active form of an active drug primidone. It is used for the treatment of neonatal seizures. In fact, it is the drug of choice for neonatal seizures. It is used in status epilepticus. You will study these seizures and epilepsy in the unit of anticonvulsive drugs. It has maximum enzyme-inducing property, hence it is the drug of choice for neonatal jaundice, that is Crigler-Najjar syndrome and Gilbert syndrome. Now coming to pharmacokinetic properties, it is excreted in urine 3/4 metabolized form, and 1/4 in unchanged form. Now what is the specific side effect of phenobarbital? It causes paradoxical excitation in children, that is hyperkinesia and seizures. Now see, barbiturates should sedate a person. They should produce calmness, they should reduce anxiety, but they have a side effect that they cause paradoxical excitations in children. You have to remember this point. Now the next drug is mifebarbital. Just remember, it is an anti-seizure drug. Now what are the side effects of barbiturates? They disrupt sleep cycle, so they are no longer used for the treatment of insomnia. They are contraindicated in acute intermittent porphyria. Why? Because in acute intermittent porphyria, there's accumulation of porphyrins. If we will give barbiturates to a person, to that patient, it has enzyme-inducing properties, so it will increase the production of porphyrins and it will worsen the porphyria. Hence, it is contraindicated. It leads to learning and memory impairment. Barbiturates also cause idiosyncratic reaction resulting in excitement in some patients, specifically for phenobarbital. Now, phenobarbiturate poisoning. At high doses, acute poisoning may occur, which is manifested as coma, depressed respiration, hypotension, cardiovascular collapse, and barbiturates blisters. How we treat barbiturate poisoning? It is treated by gastric lavage, symptomatic treatment is done, and with forced alkaline diuresis. Since barbiturates is an acidic drug, we do alkaline diuresis. We will study, I'm so sorry, this is diuresis. Hemodialysis is the last treatment. If all these treatments do not work, then we do hemodialysis. Now there's a very important questions. The drugs which are contraindicated in acute intermittent porphyria and drugs which are safe in porphyria. So there are only two class of drugs which are safe in porphyria. They are benzodiazepines and they are opioids, particularly pethidine. The drugs which are contraindicated in acute intermittent porphyria, they are sulfonamides, ergots, valproate, erythromycin, ritonavir, rifampicin, estrogen, progesterone, barbiturates, carbamazepine, phenytoin, and alcohol. Now let's start with benzodiazepines. So benzodiazepines also act on GABA chloride channel. It has GABA facilitatory action. They are relatively safer. They have wide therapeutic range of action and they are relatively safe. So what are the uses of benzodiazepines? They're used in the treatment of insomnia. Now which benzodiazepines are used in the treatment of insomnia? All benzodiazepines are used in the treatment of insomnia. They are also used as anti-anxiety drugs. So what are the which benzodiazepines are used in the treatment of anxiety? They are diazepam, chlordiazepoxide, oxazepam, lorazepam, and alprazolam. Alprazolam is also mood elevator. Now they are also used as anti-seizure drugs. Which benzodiazepines are used as anti-seizure drugs? They are diazepam, lorazepam, clonazepam, clobazam, and midazolam. Now, pre-anesthetic medication. Benzodiazepines can also be used for pre-anesthetic medication. Which are the benzodiazepines which are used as pre-anesthetic medications? They are diazepam, lorazepam, midazolam, and one more, remimazolam. They also have muscle relaxant property. So which benzodiazepine acts as a muscle relaxant? That is diazepam. So now coming to one-liners about benzodiazepines. Which is the benzodiazepine having all uses? The benzodiazepine having all uses is diazepam. Now which is the longest benzodiazepine? The longest benzodiazepine is flurazepam. Now why it is the longest acting? See, flurazepam is converted into an active form and this active form is very long lasting. Hence, flurazepam is the longest benzodiazepine. Now, which benzodiazepine causes maximum respiratory depression? The benzodiazepine which causes maximum respiratory depression is midazolam. Now, which benzodiazepine is maximally bound to plasma protein? It is diazepam. It is 99% bound to plasma protein. Now, which benzodiazepine is least bound to plasma protein? It is flurazepam. It is only 10% bound to plasma proteins. Which is the shortest acting benzodiazepine? See, earlier it used to be midazolam. Remimazolam is a new drug. So if you get question which has midazolam as an option only, you will take midazolam, and if you get remimazolam and midazolam, remimazolam will be preferred. Now the routes of administration. All benzodiazepines can be given orally. Diazepam can be given orally, intravenously, and rectal route. Now the only benzodiazepine which can be given intranasally is midazolam. Now what are the side effects of benzodiazepines? Benzodiazepines cause anterograde amnesia. What is anterograde amnesia? Inability to remember about the events which have occurred recently. So anterograde amnesia leads to repetitive self-medication in the patient. This phenomenon is known as pseudo-suicide. Now addiction is common with benzodiazepine, however it is less as compared to barbiturates. Now this triazolam has got an individual side effect. It leads to psychosis. Flurazepam leads to nightmares. Midazolam, it is given intrathecally for pain relief. However, it constricts cerebral artery. This diazepam, it dilates coronary artery, so it can be given in myocardial infarction. Now, another drug, flunitrazepam, comes under the brand Rohypnol. It is a colorless, odorless benzodiazepine which is mixed with drinks and it is misused as date rape drugs. Now we will start with insomnia. So what is insomnia? As you all must be knowing it, it is inability to sleep. So what are the drugs which are used for the treatment of insomnia? See, barbiturates will not be used because they disrupt the sleep cycle as well as they suppress the REM sleep. Barbiturates are no longer used for the treatment of insomnia. Earlier they were used. Benzodiazepines can be used for the treatment of insomnia. However, the drug of choice for insomnia is the Z drugs, which are the atypical benzodiazepines. We also use melatonins for the treatment of insomnia. So what are the two prerequisites for the drugs which should be used for the treatment of insomnia? Those drugs which are used for the treatment of insomnia, they should reduce the latency to fall asleep. What do we mean by this statement? Suppose a person is awake. Now this person is asleep. So the duration between this period of awakening to falling asleep, that is known as latency. So the drugs which are used for the treatment of insomnia, they should reduce this time period, they should reduce the latency, and they should not interfere with the sleep cycle patterns. Benzodiazepines, they cause less distortion of sleep cycle as compared to barbiturates, hence they are used for the treatment of insomnia. The short-acting barbiturates are used for the treatment of acute insomnia, and the long-acting benzodiazepines are used for the treatment of chronic insomnia. Now, what are atypical benzodiazepine or Z drugs? They are the drug of choice for insomnia. We have three drugs in this category. They are zopiclone, zolpidem, and zaleplone. So how are these atypical benzodiazepines different from benzodiazepines? See, benzodiazepines, they act on GABA A chloride channel and they stimulate. See, benzodiazepines, they act on GABA A chloride channel and they stimulate both alpha 1 receptor and alpha 2 receptor. By stimulating alpha 1 receptor, they produce sedation and sleep. And by acting on alpha 2 receptor, they produce muscle relaxant properties and anti-seizure properties. Now these Z drugs, they also act on GABA A chloride channel, but they stimulate only alpha 1 receptor. Hence, they produce only sedation and sleep. This zopiclone is the longest acting and this zaleplone is the shortest acting. Zolpidem has intermediate duration of action. Zopiclone has less effect on sleep cycle as compared to benzodiazepine. Now this zaleplone, they only reduce, just a second. Now this zaleplone is the shortest acting Z drug and it is best for the treatment of insomnia. They only reduce sleep latency and they have no effect on sleep cycle. Hence they are preferred. Now what are the advantages of Z drugs over benzodiazepine? They cause less sleep cycle distortion, they cause less memory loss, they cause less rebound insomnia, and less withdrawal is seen. Another class of drug is melatonins. They are used in the treatment of insomnia. Their advantages: they do not cause any kind of addiction or dependence. The disadvantage of melatonins is they are less effective as compared to Z drugs or other drugs. So we have three drugs in melatonins. first one is Ramelteon. It is an MT1 and MT2 receptor agonist. They induce sleep. Now coming to pharmacokinetic properties. It is metabolized by CYP1A2. Its oral bioavailability is 2 liters. Just a second. I'm so sorry. So the first drug is Ramelteon. It is an agonist at MT1 and MT2 receptor, which are melatonin receptors. It induces sleep. Its pharmacokinetic properties are it is metabolized by CYP1A2. Its oral bioavailability is 2%. I'm so sorry, it should be 2%. Its half-life is 2 hours. Now, what are the uses of Ramelteon? It is used in shift workers, those who have night shift. It is used in elderly, and it is used in jet lag. What is jet lag? When a person moves into different time zones or a different country, then he faces difficulty in his sleep cycle pattern, then it is given. Now, what is the side effect? The side effect is excessive sleeping, that is somnolency. Now, the next drug is agomelatine. Agomelatine is also a MT1 and MT2 receptor agonist, hence it is used for the treatment of insomnia. It is also the antagonist at 5-HT2C receptor, hence it is used for the treatment of depression too. So agomelatine is used to treat insomnia in those patients who also suffer with depression, hence it is used in insomnia with depression. Now the third drug is Dacimelteon. This should be Melteon, Dacimelteon. So it is approved for the maintenance of circadian rhythm in blind people. Now, what are the miscellaneous drugs for insomnia? The first one is suvorexant. See, orexin is a hormone which is produced in brain, which leads to awakefulness. So the suvorexant is a dual orexin receptor antagonist, that is also known as DORA. So since it is an antagonist at orexin receptor, hence it causes sleep, it induces sleep. Now what is the advantage? There is no sleep cycle distortion seen. The next drug is pregabalin, which is also a GABA agonist. It is an anti-epileptic drug which can be used for the treatment of insomnia. The next drug is ritanserin. Ritanserin is a serotonin blocker which can be used for the treatment of insomnia. And the last one is doxepin, which is a first generation antihistaminic. This can be also used for the treatment of insomnia. So this was all about sedatives and hypnotics. The next video will be about the alcohols. Thank you for watching my video. Please, अगर आपको ये वीडियो पसंद आया, then please like and subscribe to my channel and share it with your friends. Thank you.